This is a crisis. I do not want to be the largest mental health treatment facility in this county, but there's no other way.
The County Sheriff says it's a crisis in Michigan. People battling mental illness are filling up jails. It's often a case of having no other place to go. 25 years ago, the state shut down more than a dozen psychiatric hospitals. Mental health advocates say this cost-saving decision backfired. Now it's costing patients who are winding up in the criminal justice system. News Channel 3's Autumn Pitcher investigates this gap in mental health care and the domino effect it's creating.
Unfortunately, a lot of mental health patients fall through the cracks and wind up in jail.
Van Buren County Sheriff Dan Abbott says by default, jails are becoming the only place where many of the mentally ill are getting help.
You guys do the best you can to help them out, but you're not the best equipped to help them, correct?
Correct. We're not a mental health facility. We can only do so much on our end. We're trained to, deal with mental patients, but there again, we're not a psych hospital.
State figures show there's more than 250 people on the waiting list to get into Michigan's 4 psychiatric hospitals. And Abbott tells me a shortage of inpatient resources is contributing to higher crime rates.
They're out committing crimes and we arrest them, so it's a revolving door due to a lot of resources not being available.
Currently in Michigan, there are nearly 12,000 prisoners being provided some level of behavioral health care according to the Michigan Department of Health and Human Services. To give you some perspective, 15% of Kalamazoo County's inmates are mentally ill. In Calhoun County, that number is about 20%. I got to look inside the Van Buren County Jail, where Lieutenant Cody Small says a quarter of their inmates are mentally ill.
So this is bogging down your staff too, housing these patients.
100%.
Showing me their general population holding cell.
They got their Bibles, board games, cards, coloring pencils. It gives them some way to express themselves and explore other things.
And not cause other problems while they're in here.
Exactly.
This padded cell is where someone is placed if they pose a threat. Calhoun County Sheriff Steve Hinckley says mentally ill inmates are oftentimes a danger to themselves and correctional staff.
We have some individuals that are smearing feces on the walls, on the glass. They're breaking the video cameras. They're constantly violent from the minute they walk in to the minute they walk out.
What makes the situation even worse, inmates often find themselves in limbo waiting to be evaluated or placed in an inpatient facility.
They can't move forward with trials, pre-trials, pleas, or anything like that until they're found competent or incompetent.
We've had individuals stay as long as 3 months looking for a bed.
Hinckley believes the state's decision 25 years ago to do away with more than a dozen state psychiatric hospitals created this behavioral health crisis.
It was a mistake. Maybe somebody had some well intentions, but they certainly did not predict the consequences long term. So if I had my magic wand and I had one wish, it would be to open more state beds. That is not the complete solution to this problem, but I will tell you that is a significant start of it.
I reached out to the state health department to see how they're addressing this crisis. They declined to speak on camera, but told News Channel 3 in an email that record investments have been made recently to hire more behavioral specialists and improve access to affordable care. The state budget, however, passed by House Republicans last month, cuts Medicaid and behavioral health spending by nearly $3.8 billion, a 13% drop from last year. The budget is stalled in the state Senate, which has until September 30th to reach an agreement. In studio, Autumn Pitcher, News Channel 3.